What are the 5 most commonly asked questions about spinal tuberculosis? The first most important question that many patients ask us is about the need for anti-tubercular medicine or for how long it will be continued. The answer is simple. It is normally given for around 9 months. However, in cases if there is incomplete resolution of symptoms or if radiology shows that the infection is still persistent, then it might be required for 1 year. Secondly, people ask us about the need for surgery or what are the indications for surgery in spinal tuberculosis. So there are 3 main indications when surgery is required. First is if there is pressure on the nerve and patient is developing paralysis. Second is when there is bony destruction which is leading to deformity. Now, like our spine is straight like this. If there is a bony destruction and it is going into bend like this, then surgery might be required. Or third indication is if in spite of medicines, the disease is progressing and there is a bony destruction and pressure on the nerve. Normally we wait for 3 to 4 months after starting the medicine, and if after 4 months also MRI or X-ray is showing that bony destruction is continuing and there is impending paralysis because of pressure on the nerve, then of course surgery is required and we do a biopsy also at the same time. Thirdly, patients ask us about the bed rest. So normally if it is early bony destruction, no bed rest is required. But if it is a substantial amount of destruction, then we might recommend bed rest for 3 to 4 months. However, after 3 to 4 months, we are almost able to mobilize all the patients. Next important question is about the need for brace. So for brace, I want to tell all of you that brace is almost required in all the cases and it is given for protection. Now, brace can be, the type of brace depends on the type of spinal tuberculosis and the location. Actually, if you see, if it is a tuberculosis of the lower spine, like if it is a tuberculosis of the lower spine, this area, then we only give the lumbosacral belt. However, if it is a tuberculosis high up, say here in the thoracic region or upper thoracic region, then we require Taylor's brace. And when the tuberculosis is of the cervical spine, then we give cervical collar or Philadelphia collar. Normally, brace is recommended for 4 to 6 months, after which we can slowly remove it once the medicine starts showing the effect. The fifth and the most important question that is asked during tuberculosis treatment is what is the diet that patient should have. So the answer is simple here. Patient should have high protein diet. If you are a non-vegetarian, you can go for having a non-veg in your diet. If you are a vegetarian, then having paneer or soya bean or even protein supplement in the form of in milk is a good enough option. So you should have high protein diet. Now, only contraindication for high protein diet is if at all the uric acid levels are too high. In that case, your physician or the treating surgeon will have a look at your serum uric acid level, and based on that, he will suggest you whether you should cut down high protein diet or not. If there is no contraindication, then you should have high protein diet during spinal tuberculosis treatment. Thank you.